Good morning, everyone. Thank you for joining us for today's webinar, BHSL Updates for Assisted Living Residents and Personal Care Homes. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number, and I will be sending attendance certificates as well. A survey will be launched at the end of the webinar. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenter will address them at the end of today's presentation. The webinar is being presented by Jeanne Parisi, Director of the Bureau of Human Services Licensing. I'll now turn the webinar over to Jeanne.
Okay, good morning, everyone. Thank you for having me this morning. I appreciate your time. And I just wanted to start with COVID-19 updates. And, we last all spoke in March, and luckily we're in a very different situation than we were in March. We've seen a dramatic decrease in the number of outbreaks throughout the state. And when we do see an outbreak in the month of June, it was limited to one resident or maybe one resident and one staff. So the vaccines seem to be working. And I want to thank you and let you know, how much we all appreciate the efforts that you all made throughout this, and understanding that it was a challenge across the board. And for those that had significant outbreaks, those few weeks were more than anybody imagined. So I am really hopeful that we are looking at this as being in our rearview mirror. I'm not completely convinced yet. I'd like to see for sure that, the numbers are going down continually and we're not at risk of any variants. We are seeing still the vaccinations being relatively low for staff as compared to residents. And frequently when we're seeing an outbreak, come into the building, it's through a staff person. So we do encourage you to continue to encourage your staff to be vaccinated. And we know that that's an issue, but we would just urge you to continue to do that. I want to let you know that the RCAT is continuing through September 30th. The support that they're going to be providing is much more limited than what they've done before, but they continue to be available for infection control consultation and implementation, collaboration to identify treatment options, and alternate care settings if necessary. And I would also reach out to your RCAT, because with the funding that they've been provided, they might be doing, innovative things in their area specific to their system. So I would encourage you to reach out to them for that kind of support and to find out more about what they're doing. I wanted to make it clear that they're no longer providing on-site consultations, rapid response teams, or staffing support. And to that end, we also no longer have the National Guard support. And I know, in some cases that support was invaluable. In some cases, it was still challenging. But we're no longer able to offer that. And I do know that staffing is a challenge across the board, much worse than it was before the pandemic. And all that I can say to that is you really need to be thinking plan A, B, and C. The minimum standards still have to be met. And we're seeing even the staffing agencies having trouble finding the staff right now. So I would encourage you to contract with multiple staffing agencies beforehand, so that if you do end up in a crisis, you already have a contract in place and hopefully they can help you quickly. But, from what I've seen, even in an emergency, it can take them 3 to 4 days to get staff. to you. So for that reason, I do encourage everyone to have multiple contracts and think through, other plans. So in June, we had 26 facilities had a case, and it was one resident or one staff in each of those cases. As I mentioned, vaccination rates are low. We did issue updated guidance on June 23rd, and that was basically to incorporate the CDC and CMS guidance for long-term care facilities. So I included the link here, but I encourage you to look at that if you haven't already. And if you have questions, you can send them to us as always. So a couple of things that we're still doing as the pandemic is lessening. The virtual PCH administrator orientations are still available online. We're scheduled right now through August through PCH. We have a wait list for AL, and we will schedule another call another training in the fall. The abbreviated direct care worker orientation is still available, and that covers all of the minimum requirements that need to be covered that don't have to be covered in your facility. Your facility specific trainings you still need to do, but this would get you staffed the basics quickly if you need to be able to hire quickly and get people on board fast. And that was the intent behind that. The modified med admin program is also still available. ODP extended the timeline for the full training to be completed by December 31st, 2022, where it had been 2021. And I included the link here on their update as well. So I encourage you to take a look at that for additional information. Data collection, we have been collecting the COVID-19 statistics, I think since September or October, and we've been reaching out to facilities that had not yet reported, probably for the last 2 months. And I do know some are still having issues with their access. And I can urge you to continue to work through that, both with AS and with Deloitte in getting those resolved. But we do have a small number of homes that have been completely unresponsive. And in those cases, we are now beginning to issue violations because we've been working on this for a couple of months at this point. We will not issue a violation if you're working on getting the access issues resolved. But if you've not been responsive, we are going to start to do that. And I think we did start last week. Even if you've had no cases, you need to report at least once so we know that your access is working, and then to provide any updates as the status changes. For vaccine reporting, we will be doing another survey update in the fall, I think sometime in the late September. The tool will be slightly different than what it was, but much easier to use than the COVID-19 reporting tool and very similar to what we've currently been using. And it will also be just a snapshot. We just want to have a sense of, have your vaccine rates remained what they were or improved or decreased? And that, I think, will just be a one-time, unless, unfortunately, things get worse instead of continuing to get better. But for now, we're looking at it as one time. We are lifting the suspension of regulations effective September 30th. And we are going to be issuing a notice with additional information on each of those suspensions. But while that's in the executive review process, I wanted to let you know how we're interpreting this. We had provided for some transition timelines for a number of things. Must be completed within 60 days of the suspensions lifted or 90 days of the declaration being lifted. All of those transitions are expected to be occurring now, so that by September 30th, you're in full compliance. So if you needed to get a medical evaluation within 90 days, that 90 days is occurring now. You need to get that medical evaluation by September 30th. The only exception to that is the fire drills, and we're lifting that on July 31st. Everyone is very concerned that we've not had fire drills for over a year. I don't think anybody expected when we first suspended these regulations that we would be talking about this, a year and 3 months later. And it's a long time, and we're all frightened that the facilities are at risk by not having a drill. So we will be expecting at least one fire drill in the month of August. We will not cite for fire drills that were conducted during the suspension period. So if you've been able to do them safely without putting residents or staff at risk, we won't cite you for those. And if you want to do them in the next couple of weeks as practice drills, we won't cite you for that. Anything after August 1st, we will expect to be in full compliance. Training will be reviewed for the current training year. We're not going to do a look back to 2020. We want to know that your staff today is currently trained. So we won't be citing for trainings that were missed in 2020, as most of them were suspended. We will accept annual evaluations as telehealth visits if the physician agrees to that. I mean, we do have some concerns in that as an annual evaluation, there's a preference to being seen by your physician. But if the physician agrees that the telehealth visit qualified as the annual evaluation, we'll agree to that as well. And regular visitation is to resume by September 30th. We do know that, again, we have encouraged facilities to do what makes sense for them. But since all of the suspensions are being lifted and all of the orders have been rescinded, we will be expecting regular visitation to resume by September 30th. Still with the flexibility that, you know, facilities need to do this in a way that they can do it safely, but you can't restrict it the way that you have been restricting it. So if you're allowing outdoor visitation or visitation in a certain area because you can supervise more carefully that safe practices are being implemented, that's okay, but the limitations that we've been seeing will have to stop by September 30th. So additional funding is made available. They're going to do one-time payments again to the personal care homes and assisted living. For this round, it will be for those that were in operation as of June 1st. It'll be a similar process to the CARES Act funding, which I know was challenging and problematic. So I urge you, when the notice goes out, to submit the form, to submit promptly. And I would ask for confirmation or a read receipt or something along that line to make sure that we've got it. We unfortunately did have a couple scenarios where we didn't get the form and the provider thought that we had the form. And it's a one-time payment only, and it will be based on your census again. So look for more information on that. There's also a grant for indoor air quality management, which will be up to $15,000 per facility. And look for more information on that as well. There'll be a grant application available, and the instructions for that, excuse me, and what you need to do to qualify for it will be included in that information. So I would look for that. So annual renewal inspections have restarted effective October 2020. It was a slow start during the pandemic. In order to not contribute to the spread, we did not do annual inspections if there had been a positive case in the home in 21 days. And if we found out subsequently that a licensing rep had been in a home that did have a positive case, we then pulled that licensing rep from the field for 2 weeks to make sure that they were not contributing to the spread. We've stopped that, both of those practices at this point, because we're really only seeing one case in a facility at this time. If we do see a significant outbreak, we will resume that practice, and we won't do an annual inspection if you're having an outbreak of more than one, and we will pull staff from the field if they've been in a facility that had a high outbreak. You may be seeing we're temporarily using one licensing rep to expedite our annual renewal scheduling. We're significantly backlogged because of the suspension for 6 months and then the really slow start from October through February. Because of the items I mentioned regarding not going into positive homes and not allowing staff to go back in the field if they had been in a home, our staffing was reduced. We were also under a hiring freeze, so our staffing was reduced, and January, February, we still had a high number of homes with positive cases. So we are very significantly backlogged and still short-staffed, even though the the hiring freeze has been lifted. It's going to take us 3 to 4 months to actually post and hire and train the staff that we have been missing. And you'll see this more acutely in the central region. They just had a large number of retirements and promotions, and they seem to have gotten the worst of that. So as a result of this, we are using one licensing rep in many cases. We will continue to reevaluate that. It's not a long-standing practice. It's only temporary while we try to work through this backlog. And I do know that in some cases that means the licensing rep is on site for more time and more, it's more disruptive. But I just ask you to bear with us regarding that for now. As we work through the backlog, we'll keep evaluating this, and we don't expect it to go on past July of 2022, but we may stop the practice sooner than that. We are seeing, and understandably, but we are seeing that in the year or year and a half since we've been into many of the facilities, there are a higher number of violations, and we're seeing more provisional licenses. So, and I understand, but unfortunately, if it's a violation, we still have to cite it. So as things are starting to improve, I encourage you to go back and look that you're also paying attention to the things that maybe you didn't have the time to pay attention to while we were dealing with this, because we are seeing a higher number of violations across the board. The plans of correction, and I'm just going to restate this, and I know I mentioned it again in March, but we're seeing, as we're doing more annual inspections, we're also getting more plans of correction, and we're really looking for the quality of that. And I think there may be additional training coming, but there is training on our website that I included the link for. In any corrective action, what we're looking for is two pieces or two components to that. One is the immediate action taken to correct the violation. So, was the staff reprimanded, if that's what it was the window fixed? But also, what are you doing to make sure that it doesn't happen again? What kind of measures from a quality perspective are you putting in place so that this won't be a repeat violation? And so that it may be something very simple as adding that particular item to your monthly maintenance checklist, or it may be more comprehensive. You're redesigning your policy and your processes, and you're training staff, and you're building in a quality monitoring aspect to that. And that will depend on your own facility. I'm not of the mindset, and we are having discussions about this. I've heard staff occasionally say, well, the more serious, the more steps. And I disagree with that somewhat. In some cases, that's going to be true because whatever it was, the process was broken that allowed this to happen. But it may also be that once you fix one thing, it addresses the problem. That it's based on the nature of the violation and the nature of the violation in your facility. But we are looking always for that immediate action and the quality corrective action to prevent it from occurring again. And many of you have heard me say before, the staff are being trained that if you see it, you cite it. It's hard for us to train to any kind of a gray on that. So that's, we're trying to be as concrete with that as we can be. But the corrective action plan gives you the opportunity, if you're using that quality component, to prevent it from happening again in the future. And I do believe that our licensing standards are minimum standards. So we would prefer that we don't see any violations. The corrective actions must include the anticipated date of the completion, the staff person responsible, and a specific measurable action. The staff were trained on June 21st, but it has to be something that's concrete. The documentation, and this is, I know that it's a change in practice, and we're seeing that it's a challenge for, it's not that it's a challenge, it's just that it's not familiar, and there's a practice of submitting the documentation with the initial plan of correction. And the way that SansRight operates, you really must submit the documentation supporting the corrective action after the plan of correction has been approved. And do not submit it with the plan of correction. If you submit it with the plan of correction, then we're going to come back and ask you to resubmit it. And so I know that it's a change in practice, but if we do this, it will save everybody time. Also, we are moving away from directed plans of correction. I think that providers are most familiar with their facilities and what that corrective action would be that is going to be most effective in your facility. But that said, per the bulletin that was issued in October of 19, we don't want to go back and forth and back and forth. What I'm finding is, when we take enforcement actions, it can sometimes take us up to 6 months to do that. And that seems to me a long period of time. And so in accordance with the bulletin, we're only going to go back and forth 2 times. And then on the 3rd time, the licensing rep supervisor will issue a directed plan of correction. And it should also include those components of an immediate action and a quality action. So if you are struggling with the plan of correction, I encourage you to reach out to the supervisor for clarity on what it is that they're looking for, rather than have them direct a plan. But we will direct it, if we're not able to get an acceptable plan of correction. And with that said, if you have questions or concerns about the licensing inspection or the licensing summary and any violations or the corrective action plans, I encourage you to reach out to the supervisor for discussion. And if you're not satisfied, feel free to elevate that. Sometimes something is what it is, and it doesn't matter how much you elevate it, it's still going to end in the same place. But if you feel like there's some kind of a misunderstanding or miscommunication, I do encourage you to follow that chain of command and reach out to the supervisor, the regional director, the director of operations, and I'm happy to hear it. But the reason for going through the chain of command is because any issues can be corrected and addressed much quicker the closer they are to the source. So if you have an issue and you work it out with the supervisor, it can be resolved right there. If it comes to my attention, I need to go back to the supervisor and through the regional director and the director of operations to understand what happened, why it happened, and it will take longer. That doesn't mean that I don't want to look at it, but I don't want to look at it first, because I think that most things can be resolved with the supervisor. But my door is open, and I am happy to hear things, if you want to discuss them. So I restated this here again. I'm not going to read it because I just said all of it, but I wanted you to have it here. There's a link to the bulletin again and the training that's available. And I encourage you, if you have questions about any of it, to just reach out to us. So with that, a couple of updates. The Western Region reorganization was effective July 10th. And I've included here a list of counties that are within each region. The reason for doing this is that the Western region was almost twice the size of the other regions. And we think that it's going to be more effective to manage this way. Jody Garvey is the acting director for the Northwest region. And we were about to post for that position as a permanent position, but she would be your contact. And that information is not yet up on the website, but it will be by the end of this week, so that you have her contact information and whatnot. The regulatory compliance guide is, and I know I've been saying this for a little bit of time, but it was decided that it needed to go through the executive review process, which it currently is, and I believe it's near the end of that process. So what we've done is all of the Q&As are incorporated into the one document, so you can look for everything there, and that will continue to be our practice going forward. I expect it to be out by the end of July, and the first quarter, our target is to do quarterly updates, and we will pick various topics for each update, and that may be based on the severity of the issue or the frequency of the issue. That will be determined on a quarterly basis. And you're free to let us know if there are topics that you think need further clarification or to be added to. The first quarter that we're doing, we're only going to do minimal updates. We're looking to correct any kind of typos that we identified through the one we just finished. Any old or outdated information will be updated in this iteration, and we will, a couple of frequently asked waivers that we routinely give, like foreign equivalencies, we will address there. We will be addressing the enablers because we were pretty much finished with that topic back before the pandemic. And we will be addressing, I'm hoping to be able to address the use of Alexa, Google devices, et cetera. But this will be minimal. And so that you're aware of our process, we'll be reviewing these with the regional directors before they're issued on the quarterly basis. And then we'll be doing training with the licensing reps once they are issued and everything is final, so that they have the same information that you have. When we send out the first update, we'll also be sending out a forms survey tool that if you have topics or issues that you want us to address, you can just submit that form and we'll add it to our list. We'll be prioritizing things every quarter, so I don't know, how quickly we might get to it, but we will definitely add it to the list. So I think that this is going to be a good tool for us internally to provide more clarification and consistency across the state. And that's one of the things that we're looking for in general, is consistency as well as transparency. And this is one of the tools that we're looking to use to do that. We also began working on the electronic submission of policies for new applications. And I know, we've been doing it via email through the pandemic just so that we could continue to do it, but we are looking for a simpler method. And I'm hoping that by the end of the year, we'll have something in place. We're also looking at the ability to take on electronic payments. We initially were going to hold off on this until our new licensing system is in place, but that's going to be a couple of years down the road. And, due to the pandemic and the need to work off-site, we recognize that there's some value in doing this sooner than later. So that is coming. And then an online complaint submission form is in the works, and that's similar to what DOH and other offices have. We're no longer manning the complaint line 24/7. It's during business hours, and somebody will get back to you to follow up on the complaint, but we did change that. We found that we weren't getting calls 24/7 that we were responding to 24/7. We were getting a lot of calls that were waiting till Monday because they could. So we do, if there's a serious situation, we encourage you to reach out to OPSA, APS, or the police, but not necessarily, there's not much action that we're taking after hours. So we did away with that. And we will be doing online because I think most people just expect to be able to do that today. And that's it. Those are my updates for today. Does anyone have any questions or anything that they would like me to expand on?
Thank you, Jeanne, for that update. We are at a place where we can accept questions. So if you do have any questions, please type them in and we will get to those. While we're waiting, just a couple of updates. We do have webinars planned throughout the rest of the summer. So look for those. We have a workforce-related webinar next month on August 10th. I know that's a big issue, so please look for it. And we also will be opening registration for the annual convention to be held at Kalahari up in the Poconos. That registration will open the week of July 26th, so keep an eye out for that. Yes, we will be, I will get the PowerPoint from Jeannie and I will send that out in my follow-up emails later today. Any other questions? If you do have questions, now's the time to, we have Jeannie's captive attention today. Okay, here's a question that's come in. When will we have information? Give me a second here. It popped in, it disappeared. Okay, when will we have information on the grant monies?
I'm not sure how quickly that's going to come out. I would expect maybe within 2 weeks.
Okay, great. Another question, should we expect to receive clear guidelines regarding the change in September 30th visitation? It sounds like what we already have in place.
Well, it depends on what you already have in place, but I don't know that we're going to update our guidance further. I think my main point was that we will begin citing if a facility is not offering visitation in accordance with the regulation.
All right. Any other questions from our attendees today? Okay, here's a question. You referenced that by September 30th, we cannot limit visitation, but the current guidance indicates that we must set limitations based on size and space of the community.
Right. And so you still have to be mindful of how you offer visitation, but you can't restrict it completely. Unless, like a flu, if you have an outbreak and you're restricting visitation for safety reasons at that time, you would follow that same methodology. But we're seeing homes that are, scheduling, maybe 5 visits a week. And, we've gotten complaints where families can't get in for 3 to 4 weeks to see a family member. And we can't continue to support that. Right. And we had some discussion about this because there is some concern, and obviously if the pandemic spikes again, we will revisit this. But our anticipation is that if things continue to go the way that they're going, we should be out of the woods by then.
Great. All right, any other questions? We have plenty of time in our hour here, so feel free to type them in here. Okay, here's a question that's come in. What would your guidance be on residents who are choosing to go on leave, testing requirements or quarantine requirements?
Well, I think it would depend on their vaccination rate and where they are going. Right? If they've been vaccinated and they are, that's less of a risk. If they're not vaccinated, and it depends on your facility, is your facility mostly vaccinated, including staff and residents? At this point, as things are opening, it's harder to support quarantining just for going off-site. But if you have reason to believe that they were at an increased level of risk for that, that would be justifiable. And you should be communicating these policies to your, to your family members and your residents so that people are aware of what you're implementing.
Yeah, we're hoping to have, we're trying to pull together a session for the annual convention on visitation. We know it's still, a concern and something that everyone's dealing with and handling differently. So we're trying to get a session together on that for the early October convention.
Yeah, I think that would be good. I mean, we struggled with this internally as well. So I understand the concern, but we also, as everything else is lifted, it's hard to support not lifting that as well.
Right. Okay, a couple more questions coming in. Again, if you have any questions, please feel free to type them in. The next question is, what is your guidance on facilities taking residents on trips or outings?
I think the same thing. If they're vaccinated, I think it's fine. If they're not vaccinated, they should be wearing a mask. And the same, with staff. If the biggest issue we're really seeing is more with staff than with residents, because the staff vaccination rate is so low. But yes, at this point, they've been restricted for a very long time. So as everyone else is going back out into the community safely, and we're not seeing the numbers spike, so long as they're vaccinated or masked if they're not vaccinated.
Okay, and this ties into the next question. So I think you've answered it. What is your guidance for face masks if all residents are vaccinated and 90% of the staff are vaccinated?
It depends. In each of these cases, it depends on the facility, and 90% of, 30 staff with 5 staff are different numbers. The staff that's not vaccinated should be masked. And if they're participating with residents, the residents should be masked. We've never required masking. We've suggested masking. Residents have the right to refuse, but the guidance has been like, if you're doing a community activity and the staff are not vaccinated, but the residents are, everybody should still wear a mask.
Okay, next question. Administrators were able to complete their annual 24 hours of training online during the pandemic. Is there a time frame as to when they will be required to return to 12 hours in person and 12 permitted online?
I will look into that. I know for right now we're still accepting the online, but I'll look into that and include that when I send the PowerPoint out, so you have that information.
Great, thanks. That will be helpful for us here at the association to know as well. Next question is there any advice on getting staff vaccinated?
No, I wish I knew. It's disheartening to me that even in homes where we still saw significant outbreaks, it was still a challenge to encourage the staff to become vaccinated. I think at this point, those that are still resisting are resisting for ideological reasons that it's hard to reason with. I know some places have given bonuses, or we do have some that have said if you're not vaccinated, it's a requirement for employment. That's a hard thing to do right now because there's such a staff shortage everywhere. I'm not sure, you'd have to determine if you could take that approach. But bonuses, but even that I haven't seen make a big difference. It's more education as much as you can.
Okay. Next question goes back to education. As far as the education with all education for 2021 being required to be done by, okay, let me back up here. I'm not sure I'm reading this one right. As far as education, will all education for 2021 be required to be done by December 30 or 31 of this year, or will it be 1 year from September 30?
Right. It depends on what their training year is. So if their training year, let me think of an example. We're not going to look back at 2020. We're going to look for them to be current in this year. So that 90 days where we said in the suspension of the regulations that, this training can be suspended until 90 days after the declaration, that 90 days is actually ending on September 30th. So I would encourage you to get that training in place as quickly as possible. We're not going to cite for trainings that didn't occur in 2020. But we are going to look for the trainings to be current as of September 30th. Now for the modified med admin program, and that's administered by ODP, they are allowing the modified med admin to remain in place through December 31st, 2022. So that if staff use that program, they'll have to be fully trained by that date.
Okay, thank you for that. Next question is, has there been any discussion to ease requirements to hire staff in nursing? For example, a person who would like to be hired and is working toward their GED, but will not graduate within the next 6 months, but within a year.
On a case-by-case basis, we have issued waivers if there's shown to be good cause. So if somebody's working towards their GED, I don't know really what time frame we use per se, but we would certainly review a waiver request for something like that. We're reluctant to lower the standards, knowing that you're all struggling. We're still reluctant to lower the standards because the quality of care is still important. And lowering the standard and then ultimately potentially lowering the quality of care is not the right approach to this. That said, if, like foreign equivalencies, we issue waivers for those all the time. If you have somebody that has, 15 years of experience, doesn't have their GED, but is going to get it in 3 months, we're more likely to approve that. If they're somebody that has worked, as a retail store for 10 years and has no background in human services, we're probably not likely to approve that. But we will entertain, we'll look at any waiver requests, but that, we're not going to approve all of them.
All right. Here's another question. Again, keep the questions coming. We've got time, and we have Jeannie's undivided attention right now, so keep the questions coming. These are good questions. The next one is, due to COVID, we have found some POAs are still fearful of meeting in person to sign their loved one's contract and are asking to have it emailed. Are e-signatures permissible?
Yes. Yeah, we can accept that.
Awesome. Okay. Any more questions from our attendees today? Again, we have time. These have been great questions. Again, we're hoping to have Jeannie back with us in October for some time, likely not in-person convention, but with our hybrid event, bringing our state updates, State Department updates to you virtually. So stay tuned for that. Next question is, let me get it up here. Is there any way to expedite a waiver for staffing with years of experience?
I would say, I meet with Jill Kashmar on a weekly basis, and especially simple waivers, I tend to turn around within the week. If it's more complicated, it can take more time. But usually we get, especially for staffing, those are usually done within a week or so.
Awesome. That does sound like a quick turnaround there. So the next question is, will you accept the temporary nurse assistance certificate if the employee does not have a GED?
And let me clarify the answer to that and get back to you. I just want to make sure that I give the right answer. So let me get back to you on that.
All right, sounds great. Okay, any more questions? Again, we still have a few more minutes. Otherwise, we can give you some time back in your day. But again, questions are welcome. All right, here's one that's come in. Would you be able to share the top 5 or top 10 citations being seen across the Commonwealth?
I would say right now, we always see medication administration errors. That's always in the top 5. We are seeing more physical plant issues, and again, understandable because everybody's attention was elsewhere this year, but we're seeing more of that this year as a result. I think that those are probably the most significant ones that we're seeing.
All right, here's another question. Okay, go ahead, Jeannie.
I was just going to add, background checks is also one that, even though it was suspended, we do still have staff previously that had not had the criminal background check. So I would verify, your staff qualifications as well.
All right. Another question's come in. Can you elaborate further on the annual in-services expectations? If we are expected to be in compliance by September 30, but follow a calendar schedule, we will not have staff fully We will not have staff fully in services until December 31st. Is that acceptable?
I think that our expectation is that they're current in their training year. So I believe that we would accept that. And let me just clarify that with the staff as that's what they're doing. I will say that, the Jewish Healthcare Foundation did a number of webinars throughout the pandemic, and those are still available, and those will count for training. So I would encourage you to take advantage of those also.
Great. And again, know that we here at PHCA are offering webinars throughout, August and September. And we also have on our website, we have partnered with CEUs Are Easy, and you can find that on the homepage of our website. So those are another option for CEs. All right, here is a question. What type of physical plant issues have been cited?
I'm going to say just, lack of basic maintenance. Not any one particular thing comes to mind, but more, just a lack of staying on top of things. I don't have any specific issue that I'm seeing repeatedly. It's more just a handful of things that, people didn't stay on top of things.
All right, any other questions? Again, we still have a few more minutes. Just type your question in and we'll get to it. Give it another minute or two and see what comes in. And otherwise, we'll get you back in your day. All right, while we're waiting, I'll just, just remind everyone to stay on to complete the survey. Today's webinar has been recorded and will be made available on the PHCA website. And be sure to check out more of the PHCA's scheduled webinars currently planned, again, through the rest of the summer. Thank you, Jeanne, for your time today. This was an excellent presentation and a lot of good information. I know it's ever changing and ever evolving. COVID has certainly, challenged all of us. And again, we do appreciate everything that you all are doing out there in your communities. It hasn't gone unnoticed, and you guys are doing an amazing job. We just want to thank you for that. And again, know that we see what you've done and really appreciate everything that you have done and that you are continuing to do.
Well, thank you, and I appreciate you letting me be here this morning, and I appreciate all that everyone has gone through. It's been some year, and I've been at arm's length from it, and I just really appreciate all the efforts that people did to keep the residents safe. It's been some year, and I know to some extent we're in a recovery mode at this point, and that it didn't just go away. There's now kind of a rebuilding after the storm that needs to go on. So, I hope that this CARES Act, not the CARES Act, but the new ARPA funding is helpful. And I know you're still being challenged, and I'm sympathetic to that, but I appreciate everything you're doing to keep the residents safe. So thank you.
Yeah, I agree. It's unfortunately, it's something we're probably going to be talking about for a long time, COVID. And our convention this year, we have themed it Road to Reinvention. What is it going to take to reinvent ourselves and to move forward, post-COVID, or, again, we're still a little bit post-COVID, but we're still, in the throes of it. So, we're not quite out of it yet, but what is it going to take to, move forward? So that's our focus for this year's convention. And we do have a couple more questions that have come in. So let's get to the first one. As far as fire drills were concerned, will 2020 be reviewed?
No. No, routinely, my understanding is that we look back 12 months, and during that 12-month period, the fire drills requirement was suspended. So we will be looking for that first fire drill in August. We will not be citing for things that occurred during that suspension period.
All right. Okay, here's another question. What about DME dates? With in-person PCP appointments underway, the dates may be off. Is that okay?
It's really not okay. We are expecting that by September 30th, you'll be in compliance. If you're running into a problem, this is another area and that we would look at a waiver. If you have a good reason for why, I would encourage you to request a waiver for it. We do realize, I mean, this is all moving and it changes quickly. There has to be some endpoint, but we also know that there can be challenges that we're not anticipating. So if you're running across any of those challenges, you can communicate that to us, and I would encourage you to request a waiver where you know that you're not going to be able to meet the timeline. And again, we'll look at it. You know, I'm open to looking at it, but we would look for really strong justification as to why you wouldn't be able to meet that date.
Okay, next question is, will a facility be cited for other state departments behind in issuing certificates secondary to the pandemic?
I would make sure that that's really well documented. I don't think that we will cite you when you're waiting on somebody else to provide something, but I would make sure that you have it very well documented as to your efforts to obtain it on time.
Okay, next question is, how soon do we need our fire company drill?
That would be September 30th.
Okay, and then just a comment says, thank you. This has been very helpful, which I would have to agree very strongly. Okay, so a question here is, with that being said, if everyone has an updated and current DME by September 30th, we will still be in compliance. Is that correct?
Yes.
Okay, here's another question. Fire drill regulation has been on suspension. However, alarms need to still be tested monthly. Is that correct?
Yes.
Yeah, okay, we have just about 6 more minutes, so if anybody has any questions, please type them in. Again, this has been a really good time, and we appreciate Jeannie's time taken out today for her presentation and answering of questions, and know that, you know, Kevin and Gail are here at the association if you need, you know, if you have any questions or have anything and need help with anything, please feel free to reach out. We'd rather, you know, be here and be here for you and help than have you out there struggling. So just keep that in the back of your mind as things come up. Please don't hesitate to get in touch. That's why we're here. All right, we'll give it another minute. See if any more questions come in, and then we'll wrap up. Okay, here's a question. Are there requirements as to what the ARPA funds can be used for?
I'm not sure of the details on that yet. I would look for that when the notice comes out.
All right. Again, we have just about 5 minutes, so any more questions from attendees? This, again, was a great session. We're glad that we were able to provide this in lieu of the BHSL forums this year. Hopefully we can get back to those next spring.
Yep, that would be nice.
All right, I think we'll wrap up now. Again, thank you, Jeannie, for your time today. Just want to wish everybody a good remainder to your day and just ask everyone to stay well. Thanks, everybody.
Okay, thank you.